Hi everybody, welcome to Healthline. I am Gregory Zarin, and today is part 2 of the Heart and Vascular Institute conversation at Glendale Adventist Medical Center. Today's an affair of the heart. I do that every time we talk about the heart, because we all have one. And how well do you take care of your heart? Let me throw at you one or two statistics so it will have you sit up a little bit more intently to pay attention to this next half hour. America suffer from 1.5 million heart attacks and strokes each year. Every day, and I'll say this again, every day about 2,200 people die from cardiovascular disease. That's nearly 800,000 Americans each year, 1 in every 3 deaths. Now, I know that got your attention. Joining me now is heart specialist Dr. Naveen Sharma from Glendale Adventist's Heart and Vascular Institute. Dr. Sharma, he graduated from the University of Wisconsin in 1997. He works in Pasadena, and he has a list of specialties. Welcome, doctor.
Thank you. How are you?
I'm good. How are you?
I'm great.
Ready to talk about the heart? And before we talk about the heart, what are your specialties?
So I'm board certified in cardiovascular disease, interventional cardiology, and nuclear cardiology. That means...
Board certified, I was going to ask, what does that mean?
So for about 20 years, we've had boards.
Okay.
And basically, in order to be a board certified physician, you have to sit for an exam. And every 10 years, you have to recertify just to be able to stay certified and boarded in your specialties. I used to be quadruple board certified, but now I'm triple board certified. Sad.
Well, actually I have certifications, but not in this field. So when a patient looks for a doctor, they need to look for board certification to just feel a little more.
In this day and age, there's no reason why you shouldn't be able to go to a board certified physician.
Got it.
You should be looking for that mainly because they're the ones that have kept up with all the information, all the latest information. I mean, you wouldn't go to your friend to get treated for heart disease. Why would you go to someone who's not board certified? It's been 20 years that people have been, that these exams have been out there. And at this point in time, you should be able to, especially in Los Angeles, go to someone who's board certified. Now, at the same time, there is statistics out there that only 1 in 3 interventional cardiologists are board certified.
Well, I just love the fact that you gave us the information. So, when you're looking for your heart doctor, make sure he's board certified. More with Dr. Sharma when we come back. And I have a question. How many heart attacks happen to men? How many heart attacks happen to women each year? What do you think? Take a deep breath in. And a deep breath out. Do a little stretching. I'll give you those answers and more about affairs of the heart when we come back. Don't go away. Welcome back to Healthline. The conversation's all about affairs of the heart, and it's all about the Heart and Vascular Institute right here in Glendale at Glendale Adventist Medical Center. So I left you with a question, because you know I love my questions and my trivia. Who suffers from more heart attacks a year, men or women? What do you think? Okay, 60% are men, and up to 40% are women. So what that means, guys, is, and ladies, you have to get your heart health on. And a majority of it is through diet, exercise, and listening to your doctor. We brought in specialist Dr. Naveen Sharma from Glendale Adventist Medical Center, and he's going to share with us a lot more about what you need to take care of this. And he's board certified. Doctor, let's dive right into it. What is atherosclerosis? Because a lot of people hear about it, but they don't know what it is.
Well, atherosclerosis is actually just plain and simple hardening of the arteries.
How does that happen?
Hardening of the arteries happen over many, many years, and we've seen it as early as 17 years old, the beginnings of atherosclerosis. But the things that cause atherosclerosis include a lot of things that people can prevent. Number one cause...
Can you say that again really loud?
Most of the causes of atherosclerosis that lead to heart attacks, that lead to strokes, that lead to claudication and problems with blood vessels in the legs that cause cramps in the legs, all that stuff can be prevented by just following a couple different things. I would be out of a job if people actually did these things.
So, not that I don't want you to be unemployed, doctor. However, pay attention, get pen and paper. What are those?
Well, number one thing, do not smoke. 2.5 times, you're 2.5 times more likely to have a heart attack if you smoke. 1 pack of cigarettes a day. So don't smoke.
I smoked 2 packs a day for 20 years, and this coming very soon this year will be over 10 years that I haven't smoked. And
congratulations.
Well, thank you. And one thing
that's actually great.
I'm proud of myself on that.
After, I believe it's 15 years, no, maybe it's 7 years. After 7 years, your risk of cancer goes down to that of the normal population.
I love that.
And while heart disease and cardiovascular disease is actually the #1 cause, #1 killer presently, the #2 killer is cancer, of which lung cancer, cigarettes are the #1 cause of lung cancer.
Isn't that crazy?
Of which, once you get diagnosed with lung cancer, you have a 15%, that's 15% chance of survival unless it's caught early. 53% if caught early, but 15% if caught early. And most of lung cancer is caught too late.
And one thing I want to say too about smoking is I did not realize until recently that smoking is attributed to bladder cancer.
Yes, smoking can cause bladder cancer.
Who
Yes.
knew? So I have an idea, folks, as we were discussing previously about making a New Year's intention. Why don't you just make a choice, put something this big down and kill it? Why would you let something this small be so big in your world? Get your life back, kill the cigarettes. Because every time I was killing myself, so I completely appreciate you going off on that.
So that's #1.
#1.
All right. #2.
Oh, and you smell like an ashtray. Who wants to kiss an ashtray? You make dry cleaners healthy. And the worst part about it is somebody, when I used to smoke so much, made a comment and said, I didn't realize you painted the ceiling in my house. It was from cigarette smoke. How horrible is that? Okay, #2.
You're just paying the drug companies, the cigarette companies. So #2, high cholesterol. 2.4 times, you're 2.4 times higher. Your risk of having a heart attack is 2.4 times higher if you have high cholesterol.
What are reasons for high cholesterol, Doc?
High cholesterol, I'm going to get into that.
Okay,
So
please.
that's #2. #3, high blood pressure.
Okay.
Blood pressure above 140/90. And sedentary lifestyle, 4, which leads to diabetes.
And obesity. Over 70% of the people in this country. We are the most obese country in the world, and that is tragic to me because of all the health and wellness and diet and exercise that we spout out about.
You know, the sad thing is, of these risk factors, cigarettes, in the past 50 years, cigarette usage in the U.S. has decreased 15%.
Fantastic.
High blood pressure has decreased 15%, all right? But the thing that has increased is obesity, 20%.
Well, that's because of iPads, iBooks, computers, families being so tired that when they get home, I believe, the parents don't take their kids out and teach them how to be active and get a healthy lifestyle on. They'll be like, hey, it's a long day. You watch your TV. I'm going to do this.
Well, so the thing that presently is recommended, actually has been recommended for a long time, but has now been decreased because we're trying to get people to just exercise. In the past, the American Heart Association recommended 5 days a week, 30 minutes a day of sweating.
Minimum 150 minutes a week. We just talked about that.
Okay? But recently, because they can't even get people to do that, they've decreased it down to 3 days. So when people come in and I do a treadmill stress test on them to check to see if they are at risk for a heart attack in the next 6 months or a year, one of the big questions they ask me is, how much exercise do I need to do a day? Tell me more about this. Well, the numbers I just gave you are for the amount of time you should be exercising. But if you're looking at your heart rate, if you can check your heart rate, check your pulse, okay? 220 minus your age, 75% of that number is the number that you should target when you're exercising for those 20 to 30 minutes. So if you can do that, you're going to decrease your chance of diabetes, high blood pressure, high cholesterol, and you're going to put me out of work.
Okay, so we just found a way to make Dr. Sharma unemployed. So I just want to throw this out to you really quick before we see you on the other side. For those of you that are having your pizza and your cupcake and your ding dong and your donut and your diet soda, and you wake up one day going, oh my gosh, how did this happen? And your heart and your health is so far down the scale, You know how it happened. You made a choice. You are the captain of your ship. Get your health on. Put down the soda, have water. Put down the ding-dong, have an apple. And instead of sitting watching 4 hours of TV, compromise, do baby steps and do 2 hours and walk around the block. Baby steps to get your heart and your health on. Did you hear me? So stand up, get a glass of water, do a couple stretches. We'll see you on the other side and share with you more about heart health. Don't go away. Welcome back to Healthline. I'm Gregory Zarin, and I hope you felt that, yes, I was scolding you. Here's the deal. It's your life, it's your health, it's your choice. Have great intention. When you end up in the hospital and you are sick from a heart attack or not feeling great, other than it being hereditary, which we now know in the life and times that we live in, we can go see a doctor and we can get on a healthy path. It's your choice. What are you going to do? One of the saddest moments I've had so far this year was spending time with a friend and her 2 children, and they were both heavy little boys. And the comment was, you know, but like my husband, we don't work out. That's not an excuse. It's called pre-diabetic, and it's rising with children. So, parents, siblings, partners, wives, spouses, get your active life outside and learn how to get some cardiovascular going. We know how we get to being sick. We just choose to ignore how to be healthy. Joining us from the Vascular and Heart Institute from Glendale Adventist Medical Center is Dr. Naveen Sharma, who is board certified, and he is here to help me and you get our health on. Do you like how emphatic I am, Doc?
I love it. If everyone was like this, then, and we could get this out to everyone, you know, I definitely would be out of a job, which may be a bad thing.
And here's, I mean, listen, if
But
you need
maybe
a place to stay when you're unemployed, feel free.
Thanks.
So we were very emphatic about the smoking, very emphatic about the obesity in this country. And I'll say it again,
It's a bad
the
thing.
most obese country in the world. And one thing I want to say, though, in regards to that is a lot of people think, oh, I don't have time to create a healthy meal, and they go through drive-through. As long as it takes to go through that drive-through, it takes about the same time, because you're in your car, you drive home, you sit in line, you make your order, you do your thing. You can go home and create a healthy snack with your family.
Absolutely.
A great friend of ours here at Healthline, Melissa Lance, who has a book called The Fresh 20. Go to thefresh20.com. It's all about creating healthy meals with your family.
The sad thing is actually nowadays we work so hard that by the time we get home we're so tired that we do this drive-through thing, and the companies love this.
They do.
But the truth of the matter is we have to take this time. We have to be passionate about our own health because we only have one body. We have to be passionate about it because
We
when
have to
we
be passionate about
don't-
it, period.
yeah, if we don't take care of ourselves, no one else will.
Thank you. Okay, I'm off my soapbox.
Okay.
Doctor, we were talking about obesity, diabetes, cholesterol. What
Throw
else
it-
do we need to know about all of that? And we started
Throw
off
it-
with atherosclerosis.
So throw it all together under one syndrome. It's called the metabolic syndrome. There was a news anchor that just passed away about a year or 2 ago, having had a stress test, assessed his heart within the past 6 months, and it was totally fine. But he still passed away, and the thing that he had was the combination of all the problems, metabolic syndrome. What is metabolic syndrome? 3 out of 5 criteria for metabolic syndrome. High blood pressure over 140 over 90, or a history of high blood pressure
Okay.
on medications. High triglyceride count, cholesterol, triglycerides, bad thing.
It's all the white.
150.
It's all the white in foods. Like stay away. We had a specialist once, and she said, "Stay away from everything white."
I'm going to get into that. too,
Okay.
Okay. High triglycerides, greater than 150. HDL, I use 45 because it's easier to remember, but less than 40 in women and less than 50 in women, less than 40 in men. Okay. HDL is good cholesterol, high. I use the word high,
Right.
H,
Okay.
HDL. Fasting blood sugar above 110. Okay. And there's one more, and I'm trying to remember what that is, but it'll come back to me. When it
You'll
does,
find it.
I'll throw it out there.
Everything white, doctor. When I said everything white.
So there is something called a blue zone, all right? And there's this guy that came out of National Geographic who looked at blue zones. And blue zones are basically areas in the world where people live above 100 years old
Okay.
and have a healthy life, okay? He published a book, and actually more than one book now, put it on a website, all the findings that are associated with why these people live past 100 years old and are healthy. And the things that he found were these guys exercised. They made exercise part of their normal daily activities. They would walk to work, etc. They took time to meditate, took a few minutes a day to meditate, whether it was to go to church or go, but took time to just relax. Their diet. Most of these people were vegetarian, but those that weren't had chicken and fish. So what I'm saying by vegetarian also, I want to throw out subcategorize that. Avoid carbs. Carbohydrates are like the crypt keeper. Stay away from them. They are the death sentence. No matter what you do, you're going to find carbs.
Everything white.
So avoid them, okay? Vegetables, take an apple. Keep an apple in your pocket, a good apple. Eat an apple before you have your meal. And don't fill your stomach. Part of the blue zones concept, 80%. People would pray just before they would start eating to stop themselves from eating more than 80% full. Because when you hit it 80% full, give it about half an hour and you're actually feeling full.
And you also, it then goes back to a choice. And what's great about you saying about the blue zone is Adventist Health. And Loma Linda is a blue zone area.
It is the blue zone area of the U.S.
Period. Glendale Adventist Medical Center, Adventist Health. We will come back and share with you more about the Heart and Vascular Institute here at Glendale Adventist Medical Center. So, as Dr. Sharma said, it's about praying, it's about exercise, it's about meditating, it's about eating healthy. It's a choice. Put this in your mouth or put this in your mouth. What kind of choices are you going to make during the show and after? We'll see you on the other side. Don't go away. Welcome back. It's our last moment to talk about heart health with Dr. Naveen Sharma. Doctor, there was one more area.
So within the concept of metabolic syndrome, waist circumference. Waist circumference greater than 40 in men and 35 in women. That's the other one, the fifth factor.
So thank you for that. So we've addressed ways to keep you out of a job. Now that we're here to talk about the Heart and Vascular Institute at Glendale Adventist Medical Center, what are ways that keep you gainfully employed? What kind of procedures happen?
Well,
because it's everything about the heart.
We take care of patients when the blood vessels are blocked up. So what does that mean? When you start having exertional chest pain, that would be bad. When you're exerting yourself and you have pain, or shortness of breath, or nausea.
Which means heart attack.
Which suggests heart attack.
Suggests heart attack.
Okay. When you're having those symptoms, you need to come in. You don't need to wait. And if you're having those symptoms at rest, you need to call 911 and come in. Because time is muscle. A heart attack is when the plumbing goes out in your heart.
Time loss is muscle loss. And with stroke, it's time loss is brain loss.
Correct.
Great.
So the plumbing is all the blood vessels in your body.
Okay.
But when the arteries when they block up, they start blocking up, they scream out in help. And how they do that in the heart? With those symptoms. In the head, weakness on one side of the body.
Isn't it also something with the arm, the left arm or the right arm?
One side of the body. Arm, leg. In terms of pain, sometimes you have pains in the arm, and that's associated with heart
And also
disease.
a little bit of a cold sweat.
Sure, absolutely. So what do we do at the Heart and Vascular Institute? When you have this, if you're having it, we assess you, decide which way we got to go. If we're not sure what it is, all right, we do a stress test on you. Simple. No one dies from a heart attack, from a stress test. Everyone dies from a heart attack. A lot of people die from a heart attack. But you know what? If you treat it early, you can live a great life and be fine, okay? So stress test, if we don't know. If the stress test is positive, or if we really believe that this is heart-related pain, we take you to the cath lab, an angio suite, in which we inject dye into the plumbing, the arteries that supply your heart.
To see what's going on with the heart.
To see if there's a blockage.
And what can we find in there?
If there is gunk, atherosclerosis, all right, from hardening of the arteries, we'll see an area of blockage where the dye, the iodinated dye, hangs up. And if we see that, We can put a wire through that artery, past that blockage, blow up a balloon, put in a stent,
That's
open up
called
that
an
artery,
angioplasty, right?
save your life.
Is that called an angioplasty?
Absolutely.
Great. Okay. So then we take care of that. What other surgeries or
So let's say you're
treatments are
at
performed
risk for a stroke.
Okay.
Okay. One of the things I do is if we find a blockage by ultrasound of the neck artery, we can put a wire. Before, it had to be surgery. The only treatment was surgery. But in the past 20 years, this has been developed. I started doing this about 15 years ago. But basically, you can put a wire through that blockage in the carotid, the artery that supplies the head, blow up a balloon, put in a stent, you're done. You're out the door the next day. So, but you need to come in immediately if you're having these symptoms without doing anything, because you're killing either brain or heart. Okay? Don't wait at home on Friday night or Saturday night until the next day. Come in. What else can we do? Well, let's just say...
Let's just call it HVI, Heart Valve Institute.
At the HVI, yes, at the HVI clinic. If you have, you heard a little bit about it earlier, if you have a blockage in the arteries in your legs, that can cause cramping in your legs. Those cramps can lead to, if you're diabetic, can lead to, as it gets worse, amputation. You need to know whether you have a blockage in the arteries in your leg. We can test you easily, not invasively, for these blockages. We can CAT scan you if you need it, ultrasound you if you don't need it, find those blockages, and then we can do exactly the same thing. Put wires past those blockages, blow up a balloon, put in a stent. Now, veins. You heard a little bit about blood clots in the veins and swelling in the legs, all right? Getting in early is the best thing you can do to help avoid permanent damage to your legs. And Glendale Adventist Medical Center actually has this device called the trellis device. It's one of the, I think it's the only place in the valley that actually has this device where we can suck,
trellis device. Okay.
where we can suck out that clot easily. Come in that day, fix it up, you go home the next day. But you have to come in early.
Do you find that that's the mistake most people make, is that they don't come in?
If you look at the statistics, the problem isn't the time you come from the door 9 out of 10 times. The problem occurs before you come in the door. And that's because people wait at home. By the time they come to us, come to me, it's too late. So the best thing you can do is listen to your body. And when you have these symptoms, do something about it. Don't sit at home. I almost feel like there's a virus in people that develops as you get older.
Oh, I know what the virus is. It's called lazy. Doctor, in 20 seconds or less, give me your prescription to a healthy heart lifestyle.
Exercise, don't smoke, eat right, monitor yourself, check your blood pressure. It's a silent killer. No symptoms. Do those things. Take a baby aspirin every other day.
Is there an age for the baby aspirin?
About 40 years old.
Okay.
One last thing.
Please.
If we can't fix it non-invasively, which we can fix 9 out of 10 times, bypass surgery, we take a vein out of your leg, we put it to your heart, you're out the door. Most people, within 5 days, are home.
Doctor, I completely appreciate your time. We could be talking. You and I could be doing this for days.
Yes.
For more information on Dr. Sharma, just visit the website, www.glendaleadventist.org. Yes?
One last thing.
Please.
Glendale Adventist Medical Center was just given an award by the Centers for Medicare, which is national Medicare, saying if you come in with a cardiovascular disorder, your chances of survival, we are the 5th best hospital in the country as far as survival from a cardiovascular event.
Okay, and from a doctor that's board certified. So here's the thing. You have no excuses. This is your moment to get your health on, to get your heart healthy, and to pay attention. Everything you do is about you, your lifestyle, and your health. Remember, the most important conversation you're going to have is about you and your health, so why not have one right now? Take care. We'll see you next time. And get your heart health on. Thanks.